Thanks for joining us for Way 31 News at 10. I'm Nikhil Williams.
And I'm Dan Schaefer. We begin with new COVID-19 subvariants fueling an increase in cases. According to the state health department, Alabama's test positivity rate is now 7.8%. Right now, 3 North Alabama counties are deemed to have a high level of overall community transmission. As you can see on your screen, those counties, Lawrence, Limestone, and Madison counties, all with positivity levels at or near 12%. Tonight, there's some confusion over whether people are feeling symptomatic or just have allergies.
Way 31's Nicole Zedek joins us live now after speaking to local doctors about how to distinguish between allergies and COVID-19 and when you should get tested. Nicole.
It can be really tricky to distinguish between the two, Nikhil, because symptoms for this new subvariant are just so similar to allergies for some people, which this time of year can be especially bad with everything in bloom. Here at Synergy Wellness, they say if you're not sure if you have one or the other, it's better to just err on the side of caution and come here and get a test.
The earlier you test in the course of the symptoms, the better, so that you can, isolate yourself once you know that you're positive.
The sooner you get tested for COVID-19, the faster you can stop the spread. But how do you know if it's COVID or just some seasonal allergies?
If you have the associated symptoms of fever and body aches and, coughing and so forth, then that would be a good sign that you might be infected.
Once it becomes more than allergies, consider it a warning sign.
I've heard people say that they thought it was allergies and they had a fever. Well, generally allergies should not cause you to have a fever. So if you have a fever, you probably have an illness.
The Alabama Department of Public Health says for those who don't suffer from allergies and suddenly have some congestion, that's another sign.
So if you're not typically an allergy sufferer, although that's not 100%, you don't feel well, you may want to err on the side of testing.
Dr. Wes Stubblefield says it's difficult when many people have COVID fatigue and make excuses to get out of the house.
We as Americans, we are very driven people. We don't like to miss work. We don't like to admit that we don't feel well or that we're sick. And we tend to look for things like, say, oh, it's just a runny nose. I always have a runny nose.
Although a runny nose might not seem like a reason to get tested, the new COVID variant is the most contagious yet, and it's important to know if you do have it, that way you don't spread it to more people.
The severity hasn't particularly increased, but the transmissibility, the chance that you're going to get infected by it has gone up and up and up.
Dr. Wes Stubblefield with the Alabama Department of Public Health says it's important to keep building those layers of protection, getting vaccinated, wearing a mask, not touching your face. And he says now that the weather's so nice, meeting outside if you can. And that's just going to add one more layer of protection. Reporting live in Huntsville, Nicole Zedek, Way 31 News.